Dankie, Katlego. Ja, ons praat oor veroudering vanoggend. And I mean, Katlego touched on it with Doctor this morning. When we talk about old age, now we know that we're likely to develop wrinkles, even age spots, or even grey hair as we age. But how do we know what the rest of our body does, like our teeth or even our sexuality, for example, or our hearts? Well, today we're looking at changes in our bodies as we age. And here to take us through this topic, Dr. Darren Green joining us this morning.
Good morning.
Welcome to the show.
Thank you.
We're also going to take your calls on 0839 133 Doctor, let's get to it. Why do we age? Why is it so clearly visible in humans in comparison to animals?
Well, I think it's all about a perception as well, because I think animals do age, and
Yes.
certainly when we look at our pets, dogs in particular, you can certainly see them aging as well. But in humans, we age because of quite a few factors, environmental factors, wear and tear of the ailments, the elements. The Afrikaners have a beautiful saying when they say it looks like jy het grondpad gery, when you've been on a gravel road. And obviously the elements of stress and living a hard life, a physically challenging life, also add to the aging process. That combined with the other facets of our lifestyles in terms of how we maintain the cell function on a basic level, from what we put in terms of diet, etc., and our routines, all play an important role as to how long we can maintain this engine.
What about bones and joints and muscles? Eventually they don't work.
Yes, well, people are very fearful of losing the ability to move and do activities. So you can imagine as the bone quality changes and you get osteopenia, which is poor quality of bone, and osteoporosis, which is brittle bone, due to a lack of the architecture and the process between building bone and breaking down bone, that process slows down. In ladies, it's dependent on things like estrogen, for example.
Yes.
So as that changes, you then have more fragile bone, which makes you susceptible to pains and aches and joint pain, etc. And then there's the cartilage, of course.
You just touched on something that made me think about eyes and ears as well, you know, because that goes. I'm taking somebody to the audiologist today as
Somebody?
well. Yeah, Daddy. Yeah, hy wil nie gaan nie.
They're
What
so
about
scared,
I
yes.
know, eyes and ears.
People are very scared of being told that they've got an irreversible condition of vision. Things like cataracts, for example, your risk increases with age, and other lifestyle diseases like diabetes, for example. And then the ears, you get loss of hearing in old age is called presbyacusis.
Sure.
And that's from degeneration of the bones as well, that can occur in the middle ear.
But while you're talking about that, Susan is on the line from Witbank. Susan, you're live on Expresso. Dr. Darren Green can hear you. What's your question this morning? Susan, we can hear you. You can go ahead. Yes.
Doctor, I just want to ask you, you're getting old. Why do you got the arthritis and the...
What you say?
Susan, het jy self arthritis?
Ja,
Okay. Hoe oud is jy?
ek is 50.
Okay, so ek kan maar sê mevrou. Okay, so mevrou vra, arthritis, hoekom kry 'n mens dit? Dankie Susan vir jou vraag. Hoor, ons gaan dit nou antwoord. Okay.
So King Arthur comes to visit quite a few people in arthritis. So in different forms. So in older people, generally from wear and tear on the joints, from overloading the joints, necessarily from getting big and picking up weight, but also from having a sedentary lifestyle. You lose lubrication in the cartilage in the joints, and then you injure yourself, for example. But osteoarthritis is the wear and tear aging process of joints. But then you get other types of arthritis, which are inflammatory conditions, rheumatoid arthritis. That needs to be managed a lot more aggressively and can occur much earlier in your life. I've got kids 13 years old with rheumatoid arthritis.
Sure, I want to talk more about this because I see the condition and it's quite ANAV with most people. Susan, thanks again for your question. We're going to take more of your calls later on today. 0839 133 if you want to call Dr. Darren Green. We're talking about growing older and also the changes that happens in our bodies. Well, this is your Feel Good Breakfast Show. We'll take more of your calls after the break.